All right, guys, let's get started. So what we're going to be talking about is interventricular septal rupture versus papillary muscle rupture. How do you tell the difference? And so just backing up, both of these are things that happen within 3 to 5 days of a heart attack. And there's really three diagnoses they'll ask you about, either the interventricular septal rupture here, the papillary muscle rupture, or a free wall rupture. And so we'll kind of make this simple. If they have a murmur, you're looking at one of these two. If they have tamponade, you're looking at this one. If you can commit that to memory, you'll get most of these questions right. However, comparing the two most high yield ones, if they have no thrill and pulmonary edema, and they describe this soft early systolic murmur, you're looking at this one. And so papillary muscle rupture is when the papillary muscles that kind of tether the valve, they just break off. And so you kind of get this like flail leaflet causing a sound and then a systolic murmur. Now, when you have mitral regurg, this is a louder murmur with a thrill, and it causes signs of bilateral heart failure. And this is because the scar tissue between the septum, it's very friable and it just breaks off and it causes a new VSD. I think it makes more sense when you just look at what's happening. And so here you have the chordae and the papillary muscle, and it's kind of just ruptured here. This is what this is going to do is that every time the heart beats, this leaflet now is just flailing around. And so you get that, if you kind of imagine S1 and S2, kind of get that flail leaf making a sound, and then you have a systolic murmur for the rest of it. And really how this presents is shortness of breath with a new murmur. Shortness of breath with a new murmur. Now this one, when you look at what's happened here, so like I said, there was scar tissue and now there's a VSD. So whenever blood hits the right ventricle, instead of going to the lungs, it's just going across. And so now you have deoxygenated blood hitting the bloodstream. And so you're going to have fatigue, you're going to have a little bit of shortness of breath, but mostly you're going to have chest pain and leg swelling. And this murmur is going to have a thrill to it. So this is really how you kind of tell them apart. They might show you the flail leaflet on an echo. And so what we're seeing here is this is the chordae, this is the valve, and this is the papillary muscles. So if you kind of rupture here, this leaflet moves upwards, and that's what we've seen here. The leaflet kind of should be just stationary, but it's kind of gone off on its own. And interventricular septal rupture, it's basically a fancy way of saying that you now have a VSD. And so they could ask you some of the pediatrics questions, like what's going to happen to the murmur when you squat. But typically, this is a very sick patient in a hospital bed. They're not going to ask you any of this. And so that's about it. So know these three presentations. You either have shortness of breath, bilateral heart failure, or tamponade. And that's going to be the three answers to what happens within 3 to 5 days of a heart attack. Thank you, guys.